This would be the one change in the eligibility provision. If you have any specific questions regarding your eligibility, please address those directly with HR, as unfortunately we cannot specifically answer your individual questions. But just to let you know, high level of what changed this year, for all TSI employees, full-time employee will now be defined as being scheduled to work and maintain a minimum of 25 hours or more per week. Remember, this is a lower threshold than years prior, which was defined at 30+ hours per week. So if you're a current employee who's employed in a full-time role and scheduled to work 25 or more hours per week, you and your dependents are eligible for the health plan coverage. If you're an ongoing employee who works variable hours, your hours have been measured to determine if you're eligible for medical coverage for the upcoming plan year, and your medical benefit status will remain in effect for the next 12 months. If your new employee is scheduled to work 25 or more hours per week, you and your dependents are eligible for health plan coverage the first of the month following 60 days. If you're a new employee hired to work a variable hour schedule, you'll be placed in a measurement period of 12 months to determine your eligibility for benefits. So please note that is a change from last year. For more information, please refer to a detailed explanation located on the company's intranet, or direct any questions to your benefits/HR team. Okay, moving into the medical benefits for 2017, a couple important changes to note. So the great news is we're remaining with Aetna, so there's no change to your current carrier. However, there are some plan changes that we're going to go over, which includes a couple enhancements, as well as the elimination of the difference card this year. The difference card will no longer be utilized as of 1/1/2017. It will be direct through Aetna. So just wanted to go over the EPO plan first, which is the in-network only coverage. A couple changes from last year. You'll notice the deductible slightly increased from $2,000 to $2,500 on an individual basis, from $4,000 to an increase of $5,000 total on the family level. Your coinsurance then is 100% following you have met your deductible. Preventive care under ACA requirements is always covered at 100%, but please note if you go in for a preventive visit and ask for something outside of the scope of a preventive visit, you could see additional charges from your provider. So always want to keep that in mind. Your out-of-pocket maximum is $3,000 per individual, $6,000 per family, and new this year, your primary care office visit is only a $30 copay. So this is an enhancement, as last year with the difference card it was $40. So that is an improvement that we wanted to note. Your specialist office visit is a $50 copay. Urgent care is a $75 copay. Your pharmacy benefits, you have a $10 copay on the generic level, which is known as Tier 1. Then on Tier 2 and Tier 3, you do have a $100 deductible on the individual basis. So you would meet that $100 deductible, and then on Tier 2 have a $45 copay, or Tier 3 a $75 copay. Mail order is available on this plan, and it's 2 times the retail copay. So for example, if you have a generic via mail order, that would be a $20 copay for a 90-day supply. So mail order is always a good option to consider. Get a larger quantity and a bit of a discount for going through the mail order service. Hospital, lab, and x-ray services are going to be covered with the deductible and coinsurance. So once you have met your individual deductible or your family deductible, those things will be covered at 100% on the in-network only plan. That is the EPO. Emergency room, there is a $300 copay, which is waived if you are admitted to the hospital. This was previously $150. And please note, only visit the emergency room if it's truly an emergency, because it's actually a lot of times more beneficial to the member to try to visit an urgent care or even your primary care office if it's not a true emergency. It's quicker wait times, and members are less likely to have any sort of unexpected billing or wait times, etc., and actually just even be susceptible to certain illnesses and things lying around in the ER. So whenever you can, try to visit your primary care or urgent care service. All right, moving along now, we're going to look at the POS plan. Remember, the difference between the POS plan is this has in and out of network coverage. So if you're a member looking for out of network coverage, this is the plan would want to select. Otherwise, the EPO is a great option, and that's in-network only. The deductibles on the POS plan, again, similar to the EPO, went from $2,000 to $2,500 on the individual level, from $4,000 to $5,000 on the family level in-network. Out-of-network, this deductible increased from $2,000 to $3,000 on the individual level, from $4,000 to $6,000 on the family level. Coinsurance levels are 70% in-network, 60% out-of-network, but keep in mind when you go out-of-network, you will experience balanced billing. So despite the fact that it looks like somewhat similar benefits, you can expect balanced billing from the providers. So whenever you can, try to stay in-network. Preventive care, in-network is covered at 100%, just like it is on the EPO plan. Out-of-network, you're susceptible to the deductible and coinsurance. Your out-of-pocket maximum is $3,000 on the individual level. This increased from $2,000 last year. $6,000 on the family level. It was previously $4,000. Out-of-network, it's a $12,000 individual out-of-max, $24,000 on the family level. Primary care office visit, again, remember this was an enhancement from last year. It's a $30 copay in-network. You will be subject to deductible and coinsurance out-of-network. Specialist office visit is a $50 copay. Out-of-network deductible and coinsurance applies. Again, the urgent care copay is a $75 copay. The pharmacy benefits are the same as the EPO plan, where generics are a $10 copay. For Tier 2 and Tier 3, which is your brand and your non-formulary drugs, you will pay the $100 deductible on an individual basis, $300 deductible on a family basis, and then for Tier 2, pay $45 copay. For Tier 3, a $75 copay will apply. Again, the mail order is an option at 2 times retail, so take advantage of mail order whenever you can. Out of network, it's deductible and coinsurance, so remember, try to stay in network whenever possible. Hospital, lab, and x-ray services are subject to the deductible and coinsurance both in and out of network. And again, the emergency room copay is the same as the EPO plan. It's subject to $300 copay, waived if admitted. In network, this was previously $200. Out of network, the deductible and coinsurance apply. Okay, preventive care. There's always questions around what is involved in preventive care or preventive care visits. We wanted to highlight those details for you. TSI's got your back. Preventive care benefits are always covered at 100%, which means they're free to you, the member. Some examples are annual physicals, blood pressure screenings, mammograms, colonoscopies for ages 50 plus or those that are at high risk, immunizations, well baby, and child exams. Reminder from the beginning of our session, during your preventive exam, if your provider may find an issue or a problem that requires further testing or screenings to get a diagnosis. In that case, additional services are not considered under the preventive spectrum. Also, you may be charged a facility fee, which is not covered under preventive care. So if you ask a question or need a service outside of the scope of a preventive visit, you can expect to see additional billing or charges. Aetna Navigator is a feature that I think everyone should take the time to use. It's a fantastic resource. This is available online. Basically, you can go online and sign up as a member. It saves you time and money because while you're visiting their website, you have access to see your claims online, access information through menus, shortcuts in the site map, whether or not it's to request an ID card or print a temporary ID card. Again, you can check your claim status, view your online explanation of benefits or EOBs, and also email Aetna member services if you have any general questions. Really a key tool. You might want to save that favorite bar. Again, if you're someone that uses your smartphone more than, for example, the internet, this is a great option as well. It's the Aetna mobile app. You just go to the App Store and download this either for your Droid or iPhone. Features the Aetna mobile app. You can search for your claims, find a doctor, find an urgent care provider. That's a hot button this year that a lot of people have found to be very useful. You can check your benefits coverage and information, pull up your ID card if you need to access it while you're at the provider. Message Center, again, you can email the Aetna team with any questions. And And you can contact them for answers on your plan questions as well. So really definitely recommend taking a minute, going to the App Store and downloading this on your smartphone. Dental benefits. All right, there's no large changes this year. Again, the dental plan is staying with Aetna. TSI offers the PPO platform as well as the DMO platform. There's no changes to your current coverage. We're going to quickly highlight the PPO plan first. Again, this is the in and out of network plan, meaning that you're not subject to a select network like you are on the DMO. So you have the option to see Aetna in-network PPO providers or out-of-network PPO providers. However, remember when you go out of network, you will be subject to system balance billing, and no one likes surprises. The deductible on this plan in-network is $75 per individual, $225 per family, and out-of-network, that deductible is combined. So remember, if you've already met it in-network, you will not be subject to the deductible, again, out-of-network. Your annual maximum is $1,000. Again, this is combined out-of-network. If you do not choose to sign up when you were first initially eligible, you can be subject to some late entrant penalty provisions on this plan, meaning if you needed a major service, for example, you might have a waiting period. So you'd want to check with Aetna regarding any procedures that you have questions on. So we always recommend to do a pre-authorization of services to make sure that there's no surprises or you are not subject to any late or penalty provision. Diagnostic and preventive care on this plan is paid at 80% in and out of network. Basic services are provided at 50% after the deductible in and out of network, as well as major services are also 50% after your deductible in and out of network. Orthodontic services are available on this plan. The plan pays up to 50% with a lifetime maximum of $1,000. The DMO plan basically works similarly to a medical HMO plan, meaning you have a very select network of providers, and usually you have to go to a specific facility to receive these services. However, it is a more affordable option, and people tend to get a lot of bang for the buck if they have a larger, more major service, for example. So this is something to consider if you are okay with finding the provider in the select network. It's an in-network only plan. As we mentioned, you have to go to a specific doctor/facility. There is a $0 deductible on the individual and family level, an unlimited annual maximum, because this is really a schedule of copays for services. Diagnostic and preventive care is anywhere from covered at 100% to an $80 copay. Basic services, the copay varies by services, so you could see your benefit schedule or the full contract for exact pricing, or ask your provider to run a pre-authorization of services so you know exactly what your out-of-pocket responsibility would be. Fillings, for example, can range from $8 to $90 copay. Root canals from $6 to $403 depending on the service. Periodontics, $10 to $400 copay depending on the service. Major services are anywhere from $600 to $615, again depending on the service. Orthodontic services are available on this plan. It's a $1,945 copay, and then the plan covers it 100%. Lifetime maximum is unlimited on this plan. Okay, there's an exciting enhancement on the vision plan. Again, you're staying with VSP, and it's the same plan as last year. However, one thing to note, and it's bolded on this page, frame, the allowance increased from $150 up to $175. So you definitely have a larger allowance for frame. So that's an exciting detail this year. Again, as mentioned, this is through VSP, which is the largest vision provider nationally. Great network. You have in and out of network benefits. However, whenever possible, stay in network. You're going to get the biggest savings and the best co-insurance. Plus, as a reminder, like we mentioned, VSP has the largest network. It's somewhat difficult to find a vision provider outside of their network, but always do a search on VSP.com or call their 1-800 number. Vision exams are once per 12 months. In network, a $10 copay applies. Out of network is a $10 copay, and then you have up to $45 in benefits for the vision exam. Anything above that would be out of pocket. Materials in network are a $20 copay. Out of network, the same thing. However, remember that it's a much more limited benefit out of network. Eyeglass lenses, again, are once per 12 months. The plan pays 100% in network, and this is for basic bifocal and trifocal lenses. Out of network, it's up to a $30, $50, and $65 bend max. So that's for the basic bifocal and trifocal. Stay in network whenever possible. Frames, again, are covered once every 12 months, and this is the enhancement we mentioned a few moments ago. The plan's going to pay up to $175. Anything above that, you'll receive a 20% discount just by being a BSP member. Out of network, the plan only reimburses up to $70. Contact lenses are once per 12 months. The plan pays up to $175, and this is in lieu of lenses and frames. You can either get frames or contacts. Out of network, the plan reimburses up to $105. The Employee Assistance Program is available to anyone 24 hours a day, 365 days a year. Please, if you have any questions at all, Aetna has a professional staff of counselors that can guide you through dealing with situations, whether or not it's stress, addiction, financial counseling, daycare issues, elder care, anger management, or just to provide resource information for health and wellness. So this is a free service available to you. It's a telephonic number. You can reach by calling the Aetna Informed Health Line. The number is listed on the slide. It's 1-800-556-1555. Again, 24 hours a day, 365 days a year. If you just need to talk to a counselor and seek some advice, this is a great resource. Again, no cost to you, completely confidential. None of this information is shared back with TSI. Okay. Some more benefits. MetLife basic life insurance. You have this available to you, and TSI covers the cost of this coverage. What is the benefit amount? You have a life benefit of 1 times your annual salary up to a maximum of $25,000. The accidental death and dismemberment benefit is matched to the life amount, so that's also $25,000 in the event you suffered an accident or accidental death. Who pays the premium? Again, this is a benefit provided generously by TSI. So TSI pays 100% of this premium on your behalf. One thing to note, which a lot of people forget sometimes to do, is make sure your beneficiary is up to date. The last thing you want is to have an incorrect beneficiary in the event of a tragic life event, and getting that paperwork sorted out on the back end is never fun for anyone. So please make sure your beneficiary designation is up to date and on file. MetLife Voluntary Life, this is in addition to the $25,000 that TSI provides to you. MetLife agreed to offer a special one-time open enrollment this year, and what that means for employees is you can elect increments of $10,000 up to $100,000 maximum benefit. As we mentioned, this year MetLife's offering a one-time special open enrollment, so employees who were previously eligible and did not elect may elect up to $50,000 with no evidence of insurability, and again, this is up to the $100,000 max. Employees currently enrolled can elect up to an additional $50,000 with no evidence of insurability, meaning no health questions, etc. Again, up to the $100,000 maximum benefit. And then following, if you choose not to enroll now, the standard statement of health rules apply, meaning if you choose to increase your benefit amount or enroll at a later date, you will be subject to EOI, which is evidence of insurability, and that means filling out a health questionnaire. Rates for this plan are determined on an age-banded basis. Guardian short-term disability. This plan is the same as it was last year. So basically, you have Guardian STD benefits and of a weekly benefit amount. Plan's going to pay up to 50% of your covered weekly earnings in the event of a disability, up to a maximum weekly benefit of $170 a week. Benefits begin for an accident after the 7th day of disability, or in the event of a sickness after the 7th day of the disability. The maximum payment period is up to 26 weeks. So please note this benefit is an optional benefit for all TSI employees except for those residing in New York, New Jersey, or Rhode Island, where those benefits are state mandated. Employees who live in those states, just remember this is provided through the state. An exciting thing to introduce this year is Aetna Teledoc. This allows you to talk to a provider anytime, 24/7, 365 days a year. You can Contact Aetna, whether or not it's a face-to-face web visit or via phone, and do some general consultation. And basically, you know, if it's cold and flu symptoms that you have questions on, allergies, simple infections, things like that, again, it's a telephonic service, and it's $40 or less for the copay just to talk to a doctor 24 hours a day. So whether or not you don't want to go visit an urgent care, for example, or your primary care visit, for example, if it's nighttime, please take a look at the service. It's a great benefit that Aetna offers. A couple additional discount programs that Aetna is offering to you as a TSI employee just for being a member. You can save on some gym memberships, eye exams, eyeglasses, weight loss programs, massage therapy, and more. Information on how to access those discounts is available on the site. So remember, please reference the presentation if you have any specific questions. Okay. Through Alliant, we offer the BenIQ mobile app. Again, this is an app we strongly suggest people download to their phone. It's a great resource, available 24 hours a day, 7 days a week. You can access your benefit information, whether or not you need to see your plan highlights, find contacts. For example, if you need to know who to contact with a question, that's all outlined. You can take a picture of your ID card so you always have it on hand. Whether or not you need it at the provider's office, you just bring up the app and you can show the provider directly from your smartphone. There's great wellness tips available and a cost of care feature, which is really great. It's like a Kelly Blue Book for medical services, whether or not you want to see something, whether or not it's cheaper one zip code away. There's also important messages that TSI can send out to employees through the app. Okay. Financial benefits. You have a flexible spending account as well as a dependent care account available to you through Benefit Resource. The plan year runs January 1st to December 31st, 2017. This is a pre-tax savings account for eligible out-of-pocket health care and dependent care expenses. You can set aside up to $2,600 per year for health care expenses. And remember, this is for employees without an HSA account. $5,000 per year for dependent care expenses, and that's $2,500 if married or filing separately. The IRS changed rules and now allows for a $500 rollover on unspent FSA dollars, so that does apply to your plan this year. Please note, this is the one benefit that you need to re-enroll in every year. So you have to actively elect to enroll in this flexible spending account if you plan to have it for 2017. Dependent care accounts available as well. Dependent care FSA allows you to put aside money before taxes to pay for eligible child or adult care expenses. Again, it's the same plan year, January 1st through December 31st, 2017. You can set aside up to $5,000 per year for dependent care expenses, and again, $2,500 if married, filing separately. And this program is a use it or lose it with no rollover. So please keep in mind when you're making this election, specifically to consider how much you're putting into the account to make sure you use it and you have nothing left over at the end of the year, in which case it'd be forfeited. What do I need to do now? Next steps for 2017. So please review your current benefit enrollment in BPM. You all should have received the link in the email this morning on logging in and either viewing your benefits or making any changes. So please follow those instructions carefully. You need to decide if you want to change anything. If you do not wish to change your current benefits, no action must be taken unless you want to enroll in a flexible spending or dependent care account, which requires the annual election. If you do wish to change your benefits for 2017, make the appropriate changes in BPM and save and submit. If you no longer qualify for benefits, then you can opt for COBRA coverage or participate in the healthcare exchange plan. Please review and update your beneficiaries in BPM, and you need to enroll in BPM or make changes no later than Monday, December 5th. Below is the website, Benefit Plan Manager, in case you didn't get a specific individual email. Getting help. What to do with questions? Ask us. We're here to help. So we'll assist you with questions or issues about your medical, vision, dental, and prescription coverages. We have our team of Alliant Benefit Advocates, specifically Annalise and Karen, who are here to answer your questions. They're available 8 a.m. to 5 p.m. Eastern Standard Time by phone or email. You can reach them at the toll-free number listed, which is 819-9413 or email to benefitseast@alliant.com, and they will get back to you within 24 hours. Okay, I'm going to go ahead and open it up for any questions. Please give us a minute as we have to unmute the technology here, or check if there's any questions on the chat feature